Today, I want to talk about what's the difference between type 1 and type 2 diabetes. This is actually a question that I get asked a lot, and I want everyone to understand what the difference is between these two types of diabetes. Now, diabetes overall is a condition that affects how your body handles blood sugar or glucose. And there's two main types of diabetes. There's type 1 diabetes and there's type 2 diabetes. There are lots of other types of diabetes as well, but for the purposes of this presentation, we're only going to talk about type 1 or type 2 diabetes. And here's what you need to know about the differences between them. Type 1 diabetes is usually diagnosed in younger children or young adults, but it can occur at any age. It usually happens when the body's immune system mistakenly attacks and destroys cells in the pancreas that make insulin. As we talked about before, insulin is a hormone that helps move sugar from the blood to the cells to be used for energy. Type 1 diabetes occurs when the body does not produce enough insulin. So people with type 1 diabetes don't make enough insulin, so they have to take insulin by injection every day. Type 1 diabetes is not caused by eating too much sugar or by being overweight. It is an autoimmune condition, which means the body's immune system mistakenly attacks its own cells. Type 1 diabetes is also related to other autoimmune conditions such as celiac disease or thyroid disease. So it's important for patients with type 1 diabetes to also be screened for these conditions. Type 2 diabetes is the most common form of diabetes in adults, and it can develop at any age. It also can occur in children. This occurs when the body becomes resistant to insulin or does not make enough insulin to keep the blood sugar levels in a healthy range. In type 2 diabetes, the body's cells do not respond well to insulin, and sugar can build up in the bloodstream. This type of diabetes is often related to lifestyle factors such as being overweight, eating unhealthy foods, and being physically inactive. Unlike type 1 diabetes, type 2 diabetes can sometimes be managed by lifestyle changes like eating a regular balanced diet, exercising, and losing weight. In some cases, people with type 2 diabetes may need to take oral medication or insulin to help control their blood sugars. Insulin production is the key difference between these two. In type 1 diabetes, the body doesn't produce enough insulin. In type 2 diabetes, the body either doesn't produce enough insulin. Insulin is there, but the body doesn't produce enough or it doesn't use it effectively. Usually in type 1 diabetes, you have children or young adults who are diagnosed, and children as young as babies or 16-month-olds can be diagnosed with type 1 diabetes. Type 2 diabetes can occur at any age, but it's more common in older children over the age of 10, especially in those that are overweight. We don't typically see type 2 diabetes in young children at the age of 5 or 6, but we can see type 1 diabetes in that age group. Another key difference is that type 1 diabetes is an autoimmune condition where the immune system attacks insulin producing cells in the pancreas. In type 2 diabetes, typically, because insulin doesn't work as well, it's related to lifestyle factors like being overweight, eating unhealthy foods, and being physically inactive. The treatment for type 1 diabetes requires the daily use of insulin injections or the use of an insulin pump. In type 2 diabetes, we can often manage this with lifestyle changes, but we may also require oral medications or insulin injections. With regards to weight, in type 1 diabetes, as I said before, this is not caused by eating too much sugar or by being overweight, whereas in type 2 diabetes, it's often associated with being overweight or obese, but not always. Both types of diabetes require ongoing management and monitoring of blood sugars, and with proper care, patients with type 1 and type 2 diabetes can also lead healthy, fulfilling lives. Remember, if you or someone you know has symptoms like increased thirst, frequent urination, unexplained weight loss, or fatigue, it's important to see a doctor. Only a healthcare professional can diagnose diabetes and provide appropriate guidance and treatment. This is a condition that I commonly treat and evaluate for, so please contact me if you have a child who has symptoms of either type of diabetes so we can get the appropriate type of treatment and management plan in place.